you guys are another set of friends that are there helping me out, there for me, you know?
Hey guys, it's Dr. Ryan, and today we're going to talk with one of my patients, Chad. Chad's been a patient of the clinic for about almost a year, and he's going to describe his experiences being in the clinic. So Chad, why don't you tell us a little bit about yourself, where you're from, what you do, some of your hobbies, your family.
Sure. I'm a dentist from Goshen, Indiana. My wife and I both own a practice together. She's a dentist also. We have 4 kids ranging from 20 to 13. I would say my hobby is probably traveling, and I have a lake house that we spend time in the summer in. So being out on the water, on the boat, that type of stuff, really enjoy that.
Very cool. So why don't we kind of jump into this? What was it like before you started with the clinic and myself? What were some of the things that you were trying to accomplish in terms of your physique and overall health?
I've always been an active person, always tried to exercise, not always as frequent or often as I should. But the last 10 years or so, it seemed like it's been a struggle to, even when I was hitting the gym hard and doing the things necessary, my wife and I used to run half marathons, just felt like I couldn't get anywhere, just wasn't getting the change. And so I'd get frustrated and, back to the couch and for a while until I got frustrated again. Then I'd try something else, different programs, different things I'd done with trainers and things like that.
So you mentioned you had worked with some personal trainers. Did you try different diets? Like what were they specifically that, you're like, hey, I'm doing this and it's not working?
They were either crazy strict or they didn't fit into my lifestyle. They didn't fit into having a business and having 4 kids who are involved in sports. If I was a single person, yeah, probably I could have accomplished some of it, but it didn't work for my life, is what I found.
What was the main event that made you say, okay, enough of this, I got to try something completely different? Was there like a big inciting event that made you do that?
Yeah, so about a year ago, I decided to do the cardiac CT scan. They saw some spots that they thought would concern them a little. So at 48, here I was looking to have to do a stress test, which I luckily passed. And then shortly after that, I did my first colonoscopy. They found 4 polyps, which luckily were benign. I was to the point where it felt like I was just coasting through life and just surviving. I wasn't living. It's time for things to change.
So how did you find out about us, and what was it that finally made you say, okay, this is a good choice for me?
This type of program is something I've always kind of looked at. I had tried with a local doctor some testosterone replacement. The way that we were going about it just wasn't working for me. One of the things I tried in the past. So it's something that always interested me. And I decided to search a program like this out. And what really attracted me was how you have it tailored towards executives, because that's what I always felt like was missing. And the other things I had tried is it wasn't a program that was designed in a fashion that worked with how my life works.
It seems like you kind of alluded to the fact that it didn't, align with your lifestyle, but what particularly about that program worked and did not work for you?
First off, they didn't have any type of approach looking at everything. It was just kind of looking at the hormones. That's basically all they did for me. And I felt like it was for them, just kind of a cookie cutter. This is what everybody gets type of thing. Tried that for a good year and I didn't see any improvement or results that I felt like it was worth my time.
So after joining the program, what changes did you notice in your physique and overall health? Now, before you answer, I am going to brag on you a little bit because I am just amazed at some of the changes I've seen. So when you had started, as you had mentioned earlier, one of your bigger concerns was the potential for heart disease, right? And when you came to me, your lipid panel was not the worst I've seen, but there are certain things that we need to improve upon. For example, your apolipoprotein B was quite high when you started. Your total cholesterol wasn't terribly high, but could be improved. And your homocysteine levels were a bit higher than I liked, right? But over time, utilizing our approach, our tailored diet, exercise, supplement, and medication approach, we were able to radically reduce these values. So your apolipoprotein B went from 103 to 69. Your total cholesterol dropped almost 50 points. Your HDL stayed right about that 40 range. We got a nice drop in your homocysteine levels from 11 to 9. These are all markers that are associated with cardiovascular disease, and they're improving dramatically. Now, we still have a little bit of work to go on your CRP, but it's moving in the right direction. I am positive we'll get it down to 1, so we're moving in the right direction there. And then what I'm really pleased with is your triglycerides. They were very unhealthy at 262. We're able to almost cut them in half, more than half, right? Down to 112, which is a very healthy level. And whereas we did all of those things, we're also able to optimize your hormonal levels. And that was something I was really happy with. Right here, we're able to get your vitamin levels up, your vitamin D and B12, along with your testosterone levels to a much healthier range at 238 to 1000. So I was really, really happy with that. Very good. The other thing that I was really pleased with was obviously physique and aesthetics is very important. When you started with me, you were at a fairly unhealthy weight. I see it was about almost 312 pounds, right? And we're able to cut you down to about 250, which is incredible. Really, really amazing weight loss. I think this is, quite impressive, but the pictures are really, really impressive. This is what you kind of look like when we started. Yeah, so we definitely had to work a bit. And then currently, you're like this, much leaner, a lot of unhealthy abdominal and visceral fat. You just look much, much better. So I'm really pleased, and we're not done yet. So I'm very, very, very happy with the progression. So outside of those objective measures, what were some of the changes you noticed in your health?
One of the biggest changes, and I always thought I was a pleasant type of person, but the more I get into this, I'm just amazed at how I really wasn't. Mentally, I just kind of got through things. And now I'm to the point where I'm interested in building my business. I'm back into, working that and trying to do better there. I spend more time with my patients, talking to them. I'm checking in on my employees more, making sure things are going well with them, seeing what I can do to help them, that type of things. I'm doing so much more with my kids. I get to the point where I was just so tired from the day. I'd come home, sit on the couch, and my son would say, hey, let's do this. And I'm like, no, not today, buddy. But now I do. It's the mental aspect of it is unbelievable to me how much that's changed, as well as the physical and just being able to get around easier. And I'm not out of breath when I go places. I can do all kinds of stuff now. Go out and play basketball with the kids. I always did that before, but I was dying the whole time I was doing it. So the stress, I handle that so much easier now. It's just kind of like from being doggone it, got to do this again, seriously, and, just kind of giving up. I look at everything as a challenge now and challenge that I can correct and fix. And I don't worry about things as much anymore. In the mornings, I want to get out of bed. I'm ready to go about my day. I'm excited about my day. That wasn't the case before. Getting out of bed was like, why would I leave bed? This is much better than anything that could happen today. That's been a huge change, and that, as well as my relationships with my family and coworkers and all around, just so much better.
I'm really happy that you're able to connect better with your children.
I also noticed, as a parent, you don't always realize the effect you have on your children. They were starting to take my lifestyle of just being sedentary and laying around, especially my son. And now, even my daughter's in college, they're meal prepping. They're trying to make their meals, and they're doing healthy meals. My son, he's coming down in the gym with us. Not as much as I'd like, but we're getting there every now and then. Even our youngest daughter at 13, she's seeing what I'm doing and seems to be taking that less of a let's go grab the junk food and let's maybe get some fruit instead type of thing. So I think it's been a really good thing just for the entire family too. You don't always see the effect that you have on the people around you until you start doing something better and seeing how it's improving their lives too.
That's amazing. Were there any benefits that we haven't mentioned? Anything else outside of improving your energy levels and motivation, your biomarkers, your physique?
I just want to stress to anybody who's looking at this program, the way you guys personalize everything for each person, from the diet to the supplements to, whatever hormones or whatever you suggest. The exercise program, always having the ability to call up, Stefan and say, hey, I want to change this, I want to change that. It's done right away. Everybody's so accessible. And one thing that I was really looking forward to, and I'm glad that's what you do, is I wanted to work with you. And you guys are another set of friends that are there helping me out, there for me, and that's really cool. And I think that's a great part of the program and really what makes the program stand out above, I imagine, anything else.
Oh man, I really appreciate you mentioning that. If someone was watching this and was uncertain about joining the program, what would you tell that person? Would you tell them anything else?
All I'd say is the most important thing in your life, other than your family members, is your health. If you can't put that first, it kind of just takes away from life and everything else in your life. If you're going to spend some money, spend it on yourself, get yourself healthy, live a long life. Run around with your grandkids later down the road. It's invaluable to not stress the importance of your life.
Well, Chad, I really appreciate you taking the time to spend some time out of your super busy schedule and talk about your experience. And I want to just emphasize, I'm so thankful to have you as a patient in the clinic.
Oh, well, I appreciate you guys too. Thank you.